Welcome to the part 2, drugs for neoplasia or cancer. So we'll start with the chemotherapy. Chemotherapy is most often used to treat cancer since the cancer cells grow and multiply much more quickly than most of the cells in the body. We can give some drugs like intravenous and other as well. So there are 3 primary goals of chemotherapy, like we can cure, control, and the palliation. So goals of chemotherapy is actually to achieve a complete cure, permanent removal of all the cancer cells from the body, control or manage the disease. Cancer is not eliminated, preventing the growth and spread of the tumor may extend the patient's life. The palliation reduces the size of the tumor, easing the severity of the pain and other tumor symptoms, so thus improving the quality of the life. So to achieve a total cure, every malignant cell must be removed or killed. So the cell kill and the chemotherapy works like that. If the primary tumor cells have these much zeros in the cell, we do the first round of the chemotherapy, we can see the reduced cell size. It reduced tumor 99%, the cells are killed. When the second round of the chemotherapy reduced tumor and the 99.9% is killed, and the T cells removing remaining the cancer cells. So these cancer cell divisions, like uncontrolled cell division of the cancer cell, occurs. But when we give the chemotherapy treatment, we can see in the picture, these chemotherapy specifically targets and attacks the cells that undergo rapid replication. So that is the goal of the chemotherapy. So use of multiple drugs and the special dosing schedules, they improves the success of the chemotherapy. The reasons for the multiple drug use and the special scheduling is because we have a rapid cell division and the tumor cells, they express a high mutation rate. Tumor changes its genetic makeup as it grows, and hundreds of the different clones with the different growth rates and the physiological properties occurs. So the drugs that affect the cells in different ways and the different times in their life cycle. The reasons for the multiple drug use and the special scheduling includes this. We have a cell cycle in which there are the names of the drugs. They're showing you, this is the non-specific to phase of the cell cycle, all the alkylating agents, anti-tumor antibiotics, hormones, hormone inhibitors. They are non-specific. They are going to act anywhere. But when we say it's mitosis, mitosis is the cell division. So in the cell division, when the S phase occurs, then we have to give the methotrexate, fluorouracil, mercaptopurine, cytarabine, and topotecan. When there is a RNA synthesis done and the cells is growing, dividing faster, so we use the drugs bleomycin, etoposide, paclitaxel. If the cell has been grown and passed the prophase, prometaphase, and reached to the metaphase, then we're going to use vincristine and vinplastin. In anaphase, telophase, it goes to resting phase and it goes to the early protein synthesis. We can give them enzymes, which is asparaginase and pegasparagase. So this is a little mechanism of action of few drugs which we use as a multiple drug therapy. Now, serious toxicity occurs, which limits the therapy with the most of the antineoplastic drugs. Like adverse effects of anti-cancer drugs includes, when we are giving the therapy, there will be blood toxicity. A person can have anemia, like low red blood cell count. Leukopenia means low white blood cell count. And thrombocytopenia means low platelet count. Then gastrointestinal toxicity occurs, like anorexia, loss of appetite, bleeding, diarrhea, nausea, and vomiting. Other effects occur, the loss of hair, which is alopecia. Fatigue occurs, fetal birth defects occur, and opportunistic infections, ulceration, and bleeding of the lips and gums occur. So these are the body parts which are affected by chemotherapy. Starting from the top, we got hair loss, then pain in the head, headache all the time, mouth sores, trouble breathing, nausea and vomiting, weakened immune system, constipation and diarrhea can occur, bruising or the bleeding occurs, rashes on the body occurs, and the neuropathy occurs. So the side effect of chemotherapy on the body, chemotherapy drugs are powerful enough to kill rapidly growing cancer cells, but they also can harm perfectly healthy cells also, causing the side effects, like chemotherapy in the blood, chemotherapy in the brain, in the mouth sores, digestive distress, balding, which is the signature side effect, fingernail and the toenail trouble occurs. Chemotherapy causes infertility also sometimes. Chemo in the kidneys can occur, some kidney failure, swollen hands and the feet, anxiety and depression. Chemotherapy and heart, it includes the muscle and the motor skills, nausea, vomiting, loss of appetite, skin in the need of soothing, always, and sexual dysfunction occurs, fast-tracked menopause occurs, chemo effect on the bladder occurs, and the chemo's long-term effect on the bones also takes place. So for preventing the colds, flu, and the infections during the chemotherapy, we should use a good hygiene, consume sufficient vitamins and minerals from the diet, get plenty of rest, get the flu shot, implement the food safety practices, and monitor the oral health. Then the antineoplastic drugs that we use, they act by several mechanisms that we just discussed, and the drug classifications includes alkylating drugs, antimetabolites, anti-tumor antibiotics, natural products, hormones and hormone blockers, targeted therapies, and miscellaneous drugs. So the first is alkylating drugs. They act by changing the structure of the DNA, deoxyribonucleic acid, in the cancer cells. So this is like they are changing the structure. A cross-linking between the DNA strand should occur, but the alkylating agent is going to stop the cross-linking. So it occurs at the G phase and the strands break from here and the cells are getting apart, so no more traveling of the cancer to the next cell. Then is antimetabolites. They disrupt the critical cellular pathways in the cancer cells. Then we have cytotoxic antibiotics. They're used to treat cancer rather than infections only. These cytotoxic antibiotics, these are the drugs which are obtained from bacteria which can kill the cancer cells. They're restricted to the specific cancers and they causes the bone marrow suppression also. And there are many drug interactions also for that. Some natural products also used to kill the cancer cells by preventing the cell division. There are some hormones and hormone antagonists. They're also effective against the prostate and the breast cancers. So the hormone and the hormone antagonists slow the growth of the hormone-dependent tumors. The therapy limited to the hormone-sensitive tumors, the breast and the prostate, used as an adjunctive therapy to prevent the spread, and the least toxic of antineoplastic drugs are the hormone and hormone antagonists. They rarely produce a cure, but the primary use is the palliation. Then we have some targeted therapies and some miscellaneous antineoplastic drugs which are effective against the specific tumors. So the targeted therapy is monoclonal antibodies, which we call them as MABs. These are the drugs which are engineered, synthetically made to attack only one specific type of a tumor cell. The group attacks tyrosine kinase 9 enzyme, which is responsible for cell growth. Then we use some adjunct medications, which are sometimes necessary to treat the cancer symptoms and to reduce the intensity. So all the antineoplastic drugs are only the part of arsenal of the medications used to treat the cancer patients. The adjunctive medications are those used to supplement the primary therapies. And the three primary groups of the drugs used as adjunctive therapy are opioid analgesics to get control the pain, antiemetics to get control nausea and vomiting, and hematopoietic drugs because the person should not get anemic. So all the key drugs for the treatment of neoplasms, a list is here: alkylating drugs, bendamustine, busulfan, carboplatin, carmustine, chlorambucil, cisplatin, cyclophosphamide, dicarbazine, astaramystine, and ifosamide. Lomustine, michloroethamine, melphalan, oxalipetan, streptozocin, temozolomide, and thiotepa. Then we have anti-tumor antibiotics, dactinomycin, bleomycin, daunorubicin, doxorubicin, liposomal, apirubicin, idarubicin, mitomycin, and mitoxantrone. Then we have folic acid antagonist, capecitabine, methotrexate, and premetrexate. Hormones and hormone antagonists are the abiraterone, anastrozole, bicalutamide, degarelix, dexamethasone, enzalutamide, exemestane, ethinylestradiol, flutamide, fluoxymesterone, and goserelin, hystrelin, letrozole, leuprolide, medroxyprogesterone, megestrol, nilutamide, prednisone, raloxifene, tamoxifen. Pyrimidine and purine analogs are the triptorelin, capecitabine, cladribine, clofarabine, cytarabine, fludarabine, fluorouracil, gemcitabine, mercaptopurine, nelarabine, pentostatin, thioguanine. Selected targeted therapies and miscellaneous anti-cancer drugs includes alemtuzumab, altritamine, arsenic trioxide, axitinib, bevacizumab, and cetuximab. Erlotinib, gefitinib, imatinib, interferon alpha-2, levamisole, mitotane, ofatumumab, pezopanib, pegasparagase, pertuzumab. Procarbazine, rituximab, sunitinib, trastuzumab, wismodegib, zoledronic acid. Then we have taxanes. It's a doxytaxel, paclitaxel, teniposide. Then we have topoisomerase inhibitor and other natural products like etoposide, irinotecan, teniposide, topotecan, Winca alkaloids, vinblastine, vincristin, vinorelbin. So I call these names. I want to pronounce them, that how it should be pronounced. So the summary of the whole anti-cancer topic is that the cancer manifests as the rapid growth of the cells and can have chemical, physical, or biological causes. The lifestyle factors can lower the risk of cancer. Chemotherapy goals center on the cure, control, and palliation only. Multiple drugs improve the success of chemotherapy. Toxicity limits must be considered when antineoplastic drugs are administered. And then antineoplastic drugs work by different mechanisms, and some require adjunct medications to combat the adverse effects. Thanks for watching.